All right, I'm going to let people in. Welcome, everyone. We are just letting people in right now, and we'll start in a few short minutes. Sometimes it takes a bit to get everyone in, and I was just sharing with our presenter that it seems every time I'm on a Zoom these days, I'm going in to get connected, and then it has 12 updates to do. So the great thing is it's getting recorded. So in case anyone misses anything, they can go back and do that as well. So we'll give it another couple minutes. All right, I think we're just going to get started this morning. So welcome, everyone. I'm Michelle McGrath. I am the project coordinator for the Wanakee Community Cares Coalition, as well as the district governor for Rotary D6250. And we are so thrilled to be partnering with the National Alliance of Mental Illness, NAMI, here with Stacy Moore today. She is going to be leading us through some really great information, resources that we can use at a community level, at a state level. We have had lots of conversations about what our needs are in our communities, and we have put together a series of virtual presentations that NAMI is going to be facilitating for us, as well as one in-person one this spring. This upcoming weekend, we have students from our coalition, our student coalition. They're walking in the NAMI Walk, as well as Rotarians from around the state walking in the NAMI Walk in collaboration with, sorry, I'm trying to admit people and talk at the same time. So, so to get started, like I said, Stacy Moore Johansson, she is the Associate Director of the National Alliance of Mental Illness, and we are thrilled to be, like I said, collaborating with her and her team on how to bring resources and programming communities to best serve all the challenges that we're dealing with around mental health. Stacy's going to have some great information for us, and like I have talked about before, it's going to be recorded. I know a lot of people they're busy in their work lives, that they're going to be definitely catching the recording, but this will be both on our Wanakee Community Care site. It'll be on the Rotary District 62 site, as well as there will be accompanying resources with the information given out today, because Stacy's going to throw a lot of links at us and resources, and just know that they're going to be sent out to you in an email, so you'll have access to all of those. So without further ado, I just want to thank Stacy again for joining us, and welcome everyone to this important webinar, and we look forward to hearing from you, Stacy.
All right, thank you so much, Michelle, and welcome everyone. I'm really happy to be here. My name is Stacy Moore Johansson, and I am the Associate Director at NAMI Wisconsin. And today we're all here to discuss, I'm here to present on mental health and mental illness. So this presentation is called Let's Talk About Mental Health, Language, Stigma, Wellness, and Support. And I'm going to pin myself quick here. All right. So as Michelle mentioned, I'm going to send this PowerPoint presentation to her after I present with you all today. I wanted to throw my contact information up here. If you have any questions, please feel free to reach out. So what are we learning today? I'm going to go over who is NAMI, what our organization does, and the 3 tiers of NAMI. I'm going to talk about stigma surrounding mental health and mental illness. I'm going to give you a really high level mental health, mental illness 101, just so we can kind of understand the differences and the basics and really lay a foundation as we work towards our next webinar and then the in-person presentation that we're doing with the Rotary in April of next year. I'm also going to talk a little bit about language. I'll cover a bunch of resources. NAMI, that's one of the main things that we do, is provide resources to our local community, state, and then nationally. So tons of resources that we have linked for you. And then last, we'll end with supporting yourself and others and focus a little bit on workplace wellness. And let me just say too, I'm really excited to be here. This week is Mental Illness Awareness Week, which is recognized nationally every year, the first week of October, as Michelle mentioned. There's a lot of NAMI walks going on this weekend. Some of you may be participating or have heard about it. So it's one of many awareness events that we do at NAMI, and then for those in the mental health, mental illness community nationally. All right, everyone. So who is NAMI? NAMI is an acronym. It stands for the National Alliance of Mental Illness. And NAMI is the nation's largest grassroots nonprofit organization. And we were founded in 1979. So we're just a little bit over 40 years old. Currently, there are over 600 local NAMI affiliates and 49 state affiliates like myself. I'm from NAMI, Wisconsin, which is the state chapter across the United States. And so I always like during presentations like these to provide a link. We really encourage people after this, find your local NAMI. If you have friends and family living in other states, share this link with them so they can get familiar with their state's NAMI and local affiliates as well. Let me also say too, so NAMI was actually started here in Wisconsin, which is a fun fact that not a lot of people know. And it was started by a group of women who lived in the Madison area. And there were little to no services at that time for their adult children. Most of them had adult sons who were living with serious mental illness. So they, some of their sons, this was in the early 70s, had schizophrenia. They had bipolar or borderline personality disorder, and they were not getting the care and support from their doctors, from their community, from their legislators. There were virtually no services for them. So these women band together and worked towards founding an advocacy organization, which at the time they called AMI, which means friendship in French. And it grew over time to what now is a national organization. So they added the N onto that, and that's where NAMI came from. And then we made it into this wonderful acronym. So it's a fun fact. A lot of people don't know that NAMI, now being the largest nation's grassroots organization, was founded right here in Wisconsin. So we always like to plug, and we're proud of that. And then we always like to say, you know, don't mess with Wisconsin moms, because look at something they were able to create. So looking at us today, who are we? So NAMI today is a 3-tiered organization. So there's NAMI National. They are located in Arlington, Virginia on the East Coast. They have employees spread out all around the country, some in person, some working remote. And then, as I mentioned, there's 49 state affiliates. So I work for the state affiliate, NAMI Wisconsin, and we're located here in Madison, in Dane County. But then there's also local NAMI chapters, or what we say affiliates, throughout the state. So regardless if it's NAMI National, one of the 49 state affiliates, or if you're a local NAMI affiliate, we all have the same mission, and that is to improve the quality of life for people affected by mental illness and to promote recovery. So I want everybody to just kind of take a look here at the map. These are the current NAMI affiliates that we have in Wisconsin. As you can see, some cover one county. So as I mentioned, we're also located here in Madison in Dane County, but there's a local NAMI chapter here as well called NAMI Dane County. But some local NAMI affiliates also cover more than one county or make up a whole region. It really just depends on the community and the structure that's in place. And all of these affiliates function a little differently. I would say about half currently have paid staff and board of directors, and they're their own nonprofit organization within the NAMI Alliance. But the other half are actually fully volunteer, and they really rely on their board of directors and their community members to volunteer their time to keep their NAMI afloat. And that's one of the biggest and most important things that we do at the state level at NAMI Wisconsin, is that we work to support these 25 local NAMI affiliates spread throughout the state of Wisconsin. And what they do is that they offer free support groups, educational classes, and presentations within their communities. So I want to talk a little bit about the 4 pillars of NAMI. One being support. So NAMI affiliates provide peer-led, no-cost support groups offered by trained volunteers. So this is a training that we put on at the state level, and all of our local affiliates send people within their community that they think would be a good fit to facilitate a support group to our training. Then they go back to offer it locally within their community. We also do educational classes. So there's a wide range. It's just ensuring from people from identifying as peers, so living with a mental illness, or family members. You yourself have a loved one living with a mental illness, that there's educational classes that cover both. Some are specific to youth, some are specific to veterans. It really just depends. We also do a lot of awareness. So we work really hard to promote public education and understanding of mental illness locally and statewide. And then last, what we do is advocacy. Excuse me. So we advocate at all levels of government to improve mental health care in Wisconsin. So I want to do a little exercise with you all. I always like to do this, especially when we meet for the first time with a different group. If a few of you just feel comfortable and want to throw in the chat, what is your perception of mental illness? Or maybe what words or word come to mind when you hear the term mental illness? So I'm going to give you all just 30 seconds or so. There's no wrong answer. So anything that comes to mind, please feel free to just throw in the Zoom chat and I can read them off for the group. So usually when we do this exercise, this has really changed over time. We give presentations like this in front of law enforcement, teachers, providers, and years ago, this has really changed specifically over the past 5 years, but we would throw this question out there, and we would see terms like scared, violent, homeless. But more recently, in the past handful of years, we've seen terms like alone or family member, or lack of resources. And I bring this question up just to kind of create some thought in your minds as we near and start the conversation to discuss stigma. So I want to talk a little bit with you all today about stigma around mental illness as well as mental health. I think that that's really why that there's a shift in this conversation, is because through education, people are understanding and having a better grasp on mental health and mental illness and realizing that it does affect everyone. So what is stigma? Stigma is a set of negative and often unfair beliefs that a society or group of people have about a particular circumstance, a quality, a person, or a group of people, right? So usually, as I'm sure we all know, stigma often stems from a lack of understanding or fear, and it can lead to really deep levels of discrimination for that group or that individual that is being stigmatized against. Historically, and even today, many people have negative views about mental illness. So I threw out some of these words, but homeless, dangerous, violent, uneducated, weak, or a lot of people, if they know or hear about someone who has a mental illness, they question the family. So what happened to them versus thinking about it as a brain disorder. How does stigma affect mental illness? So in your life, when you know someone, a friend, a family member, a neighbor, a coworker, and they have a heart attack, maybe they break a bone, they break their leg, they're diagnosed with a physical illness. What do? We usually shower them with support. We send them a card. You bring them food. You let them know that you're thinking of them and that you're there for them. And unfortunately, that's not always the case when it comes to someone who is diagnosed with a mental illness. So what we are really working hard towards at NAMI is something called Joining the Casserole Club. So it's treating mental health and mental illness just the same as physical illness, and not being afraid to have that conversation with someone that you know in your life that may really need that support and is open enough to know that they're struggling with a mental illness. So I want to talk a little bit about mental health and mental illness 101, just to kind of get us all on the same page here. So what is mental health? Mental health can be defined as the way we think, we feel, and how we as people relate to others. Every day and each day, your mental health can be really good or it can be really bad. So we always like to bring to everyone's attention, especially as mental health has become a huge topic in today's world, which is so important. Um, we all have bad mental health days or we're not feeling as great, but that does not necessarily mean that we have a mental illness. So every one of us has mental health, but that does not necessarily mean that we have mental illness. And this is something that we really like to promote at NAMI because these two things work side by side, but are not necessarily working together. And there's also a lot of confusion when it comes to mental illness about mental health, and that word is thrown around. So then when does mental health become mental illness? So a person may be diagnosed with a mental illness when their symptoms are persistent for a period of time, usually over 6 months. Um, it is causing significant distress and disruption in the individual's daily ability to function. And overall, it's really just decreasing their quality of life. So as I said, it's helpful to kind of wrap your mind around this because this is high level, to think about these things separately. So mental health and mental illness are separate for everybody, working independently from one another. And I like to think about it that you could be living with a mental illness, but you could be doing really well and have really great mental health in a certain period of your life. You could also be a person that is not living with a mental illness, but you have really poor mental health. So they don't necessarily all reflect each other. When it comes to mental illness, it's really important to point out that mental illnesses are not caused by personal weakness. They're not caused by a lack of character or a poor upbringing. Mental illnesses are medical conditions of the brain, which is why we need to think about it the same mental illness, mental health as physical health. And mental illness should be viewed the same in that respect. Mental illness is also common. 1 in 5 adults experience a mental illness each year, and the other 4 out of 5 people know someone living with a mental illness. Your friend, your family member, your coworker, your neighbor, your friend's children, for example. The list goes on and on. 1 in 20 US adults experience serious mental illness each year. And serious mental illness, this can kind of be a flexible term, but really that's looking at mental illnesses like schizophrenia, bipolar disorder, and borderline personality disorder. So they're illnesses that cause serious disruption in someone's life, that there are some medications to help with it, but it doesn't necessarily work for everybody. And 1 in 6 US youth aged 6 to 17 years old experience a mental health disorder each year. And this number is unfortunately rising. And 50% of all lifetime mental illnesses begin at age 14 and 75% by age 24. And it's important to remember too, with mental illnesses, depression, anxiety, schizophrenia, borderline personality disorder, PTSD, for example, each person has a different experience with the same diagnosis, right? So it's not the same experience, it's not the same journey for everybody. I just want to quickly go over just the different categories of mental illnesses and just to hit on a few things for each of the common types of mental illnesses. So for depression, depression is a mood state that goes well beyond temporarily feeling sad or blue. We've all been there. So this is a consistent low feeling for you for more than 6 months of a period of time. And depression is a very serious medical illness that affects your thoughts, feelings, behavior, mood, and physical health. This is a term we've kind of adapted in our society, which is fine, but saying that, we're feeling depressed, but really recognize that serious depressive disorder is debilitating. for many individuals within the world. There's also PTSD, post-traumatic stress disorder. It can include both an event that threatens injury to oneself or others, and then a response to those events that involve persistent fear, helplessness, or horror. So trauma plays a huge part of that and really affects us with PTSD. And again, this looks a little different for everybody. Borderline personality disorder, I threw this out a couple times. So BPD is also the acronym for that. It's characterized by intense and stormy relationships, really low self-esteem, sabotaging acts, mood fluctuations, and impulsivity. Impulsivity is a huge one here. And really, it's a really tough one to diagnose, because I'm sure in that description you're thinking that kind of fits a lot of different diagnoses or different individuals you may know or things you may have experienced. But the hallmark of this is really emotional dysregulation. So a severe difficulty to manage emotions under stress, and the ability, think about with borderline personality disorder going from functioning to just completely non-functioning individual in society. Generalized anxiety disorder, people that live with this display excessive anxiety. That's the key word here, excessive anxiety or worry, most days for at least 6 months, that affect their personal health, their work, their job, social interactions, and those everyday routine life circumstances. And that fear and anxiety can cause significant problems in their lives, social interactions, school, and work, and really just makes it debilitating for those individuals. Schizophrenia, many people living with schizophrenia have sensory, auditory, or visual hallucinations or delusions, meaning they hear or see things that aren't there and believe things that are not real or true. Paranoia is a huge and common symptom of this. There's still a lot of research being done about schizophrenia. It is genetic. And they're trying to figure out different medications to help with this, what brings this on in the brain, why people living with schizophrenia hear typically negative thoughts. So it's one of those that there's still a lot of research and a lot of unknown, which is really unfortunate. And then there's bipolar disorder. Bipolar disorder causes unusual and dramatic shifts in mood, energy, and the ability to think clearly. Mania, you may be familiar with that term, is a really common observed symptom. So it's either a period when you live with bipolar disorder where you may be experiencing a manic episode where you're not sleeping, there's impulsive buying, impulsive socialization, sometimes impulsive gambling or sexual activity. A lot of times people aren't sleeping. Sometimes they seem really positive and happy and like they're doing really well, but they're in a manic state. And then with bipolar disorder, that will eventually stop, and then they will essentially crash and then be in a really depressive state. So that's a good way to think of bipolar. It's extreme, extreme highs and extreme, extreme lows, and then inability to kind of function in the middle. Also included in mental illnesses are neurodevelopmental disorders. So what's included in that is autism spectrum disorder, ADD and ADHD, which are now clumped together as one term, and other intellectual disabilities. This is something newer that we're talking about because, again, a mental illness is a disease of the brain. And then these are neurodevelopmental disorders, so they're categorized together. Along with that is also obsessive compulsive disorder, OCD, and then other related obsessive compulsive disorders, as well as eating disorders, because they all affect the brain. I always like to point out the co-occurring disorders within mental illness. So many people that are living with a mental illness have co-occurring disorders. And this means that they're living and struggling with other things that coincide with their mental illness. Some are due directly to that mental illness. Some are due to the treatment, so the medication, and then others kind of come from that serious mental illness. So to kind of make more sense of that, the list could be an addiction to alcohol or other drugs, addictive behavior like gambling, overspending. Sometimes you'll see tics with that, which is an addiction for them. Obesity, a lot of times that comes from medication that people are taking for their mental illness. Going hand in hand with that then is diabetes, TD or tardive dyskinesia. That is a side effect from long-term use, from taking medication from serious mental illness. So certain medications for schizophrenia or borderline personality disorder cause TD, which is kind of like a constant shake, physically in an individual. Increased morbidity and mortality rates, and also an increase in suicide and suicide attempts. So, in explaining all of these, it's tough, right? You know, that's a lot of heavy topics to talk about. So we always like to point out that mental illness is treatable and recovery is possible. So there are so many tools that you can use and your loved ones can use and your friends can use to improve their journey of recovery if they're diagnosed with a mental illness. And there's no right or wrong path. People need to figure out what works best for them. So that could be medication, that could be counseling or therapy. It could be different coping skills. It could be a social support network, going to support groups, or educating themselves about their mental illness. It could be things more on the holistic side, like yoga or acupuncture. You know, it's or a combination of all of those things. So what we always like to share with people is educate yourself, for you or yourself. If you're a family member or you have a loved one or that individual, learn about your diagnosis. Create your support group. Find the right professionals, find the right peers, find the right support groups, create a network around you. Understanding your healthcare options. So understand what your insurance covers, what medication may help you, what the side effects of that medication are, how much that costs. You know, get a really firm grasp for that self. Involve your family and friends in treatment. It may seem scary, and there still is a lot of stigma around mental illness, but the more you talk about it and the more you have other people involved, um, the earlier you can intervene and get the help that you need. And really, the earlier the better. Don't wait. There should be no shame if somebody is struggling and trying to navigate this within themselves. And so now that we kind of have a mental illness, mental health 101, and we talked about stigma, I always like to jump back to the stigma piece and really point out that stigma for those living with a mental illness is discrimination. So there's a lot of mental illness parity within insurance companies. So that's basically having coverage within your healthcare for what they call behavioral health. That should be covered for you just the same as a physical illness. So people shouldn't be paying thousands of dollars out of pocket for medicine that they need or providers that they want to see to get the mental health and mental illness help that they need. Sometimes it can be really tricky on that end. Registration to receive medication, short and long-term disability within the workplace. A lot of times, if you look at it, the physical short-term disability, mental illness, or behavioral health is not listed in there. And as many of us know, if you're experiencing a mental health crisis or you have a loved one, right, as a family member, this takes a toll too, and you're trying to help your loved one with navigating a mental illness, you may need that short-term disability to get them the help they need. Of course, there's jail time instead of medical care. We're intervening with people who are experiencing a mental health crisis and throwing them in jail. There's no resources there for them. They're not getting the help that we need. So discrimination is actually a legal term, right? Where stigma is more of a social feeling. So we're trying to educate on stigma, but then move towards this word of discrimination to bring awareness for people living with a mental illness, their family members, providers, and the list kind of goes on and on. So I want to share with you all some NAMI resources. And I really encourage you after this presentation, when Michelle shares this with all of you, to really go through and click these links and take a look at them and share them with your friends and family. So NAMI has a ton of resources, whether it's NAMI National, us at NAMI Wisconsin, or finding your local NAMI affiliate and seeing what resources are in your county or region. So that first link on there goes to our website, the NAMI Wisconsin website. Please find your local NAMI affiliate or find the affiliate that's closest to you. We also have our NAMI Wisconsin resource guide that you'll see on the screen in front of you, the bottom left with the purple iris. So this resource guide we put together annually and edit extensively. And we have a breakdown for every county in Wisconsin, regardless if there's a NAMI affiliate or not, all of the crisis resources, if there's peer-run respites, warm lines, health and human services, in the world of mental health and mental illness, anyone that you would need to talk to. We also have resources, legal resources, resources if someone is experiencing homelessness. It's kind of the all extensive go-to guide for the state of Wisconsin for mental health and mental illness. We also have information on there for all the NAMIs in the state of Wisconsin, as well as the peer-run respites, warm lines, and so forth. NAMI National, as I said, we're a 3-tiered organization. So they have a really great booklet called NAMI National's Navigating a Mental Health Crisis. It goes a little bit more in depth to what a mental health crisis looks like, what to do, how to react, who to connect with, how to help your loved ones, and then what that looks like in different states and communities. And then they also have a resource directory. So I want to point out too, in Wisconsin specifically, we have a platform called Being Together, and this is a statewide virtual mental illness support group platform that's on our website. So the idea behind that is that any local NAMI affiliate who's offering a virtual support group or a virtual education class works with us, and then we put their information on our website. So anywhere in the state of Wisconsin, regardless if you have a NAMI affiliate or not in your community, can access and sign up to access these free support groups and educational classes. So even if you're in a rural community or you don't have a NAMI affiliate, or if you have a NAMI affiliate in your area, but they may not be offering the support group or class that you're looking for, you can go on to Being Together and sign up and receive that free support group or educational class that you're looking for. I always like to plug 988 at this point when we're presenting. NAMI Wisconsin, as well as a lot of other mental health and mental illness advocacy organizations, as well as Wisconsin Department of Health and Human Services, had a seat at the table for the 988 Wisconsin chapter. Some of you may be familiar with this, some of you may not be. So 988 was previously the Wisconsin Suicide Prevention Hotline. And now they're really trying to market and rebrand, and they've totally overhauled it to be 988. So the idea is when someone needs some mental health, mental illness support, or is in a crisis situation, instead of calling 911, we're asking that you call 988. So we're hoping in 5 years, 10 years, that it's well known across the country, just like 911. So it's a free 24-hour confidential support line for people in distress who need prevention and crisis resources. You can call yourself or on behalf of your loved ones. And it's a really great resource. And here in Wisconsin, it will actually work similarly to how it works when you call 911. So it pings your area code to connect you in Wisconsin to the closest 988 headquarters. And you'll speak with a person that's here in state who can refer you and talk to you to get you the resources that you need. So for myself, I am not originally from Wisconsin, so I don't have a Wisconsin number. So if I were to call 988 and that person answered, I would tell them, I live in Madison, Wisconsin. Please connect me with the 988 chapter that's there. All right, I want to talk a little bit about language, kind of going with mental illness and with stigma as we can continue our presentation. So language is always evolving. We know this, right? And at NAMI Wisconsin, we really do our best to use the correct language when addressing others, but we understand people make mistakes. People aren't aware of language changes. I'm guilty of this all the time. So it's always important to point out when someone is using stigmatizing language around mental illness, but understand that there's not always malicious intent, right? They're words. All we can do is just do our best. And if you don't know, ask. And so we talk about language too, because as we eliminate stigma around mental illness, we will encourage others to get support and not wait, and that there's no shame. So the big thing that I want to communicate with language in the NAMI world for mental illness is to use person-first language. So with person-first language, we want to put an emphasis on the individual rather than their diagnosis or condition. A person is not their disorder, right? They're people, their neighbors, their parents, their siblings, their professionals. The list goes on and on with all the hats that we all wear, right? So a person should always be placed first, then their conditions second. And ultimately, as I said, this will really help to make a person who's living with mental illness feel welcome and eliminate those stereotypes and stigma. So some examples of that, so you can put the pieces together to what I'm talking about. You don't want to say the mentally ill. What you want to say is a person or people who live with a mental illness. You don't want to say he, she, they are schizophrenic. So that's putting the diagnosis first. You want to say a person who lives with schizophrenia, or even a person who has schizophrenia is completely fine. Same with suffers from. There's a lot of people who are diagnosed with mental illness. Again, it's a disease of the brain. And they live, of course, many live fully functional lives and are able to balance that. So you don't want to say they're suffering from. They live with, they have, they experience. Instead of a psychotic break, you say that person broke. What happened? You might want to say they're experiencing psychosis or they're experiencing a mental health crisis. And the list kind of goes on and on. And when I give presentations like this, I always like to bring up the example of physical illnesses, cancer being one. We unfortunately all know someone who have been diagnosed with cancer, and you don't say, yep, they're cancerous, or yes, they're colon cancer. You would say they have cancer. So we're kind of just trying to adapt that language. So just as a plug, your language matters. It may not seem like it does, but we really appreciate an evolving and conscious effort to reduce the stigma and discrimination for those living with mental illness and their families. So I feel like we've talked about NAMI, we've talked about mental illness and mental health, we've talked about stigma, we've talked about resources. So now for the remaining 15 minutes or so, and then I want to make sure we have time for questions. I want to talk about supporting yourself and others. So what exactly does that mean? Currently, in the workplace, unmanaged mental health conditions cost our country and our economy around $200 billion in lost earnings each year. And this is through decreased work performance and productivity. Short-term disability, if you have this for mental health or behavioral health, are growing 10% annually and can account for 30% or more of disabilities for the typical employer looking across the country. As I mentioned before, this may not be you living through this, but you could be a family member who has a loved one, your spouse, your child, your parent or a sibling that you're helping to take care of. So it affects the family, it affects the whole family. So that's increased leave for you as a family member. Unfortunately, those are some pretty rough statistics, but most mental health symptoms improve with proper support. So, workplace wellness and mental health wellness is taking a huge, leaps and bounds within our country. And people are really educating themselves and trying to make a conscious effort to have leaders in your companies, in the businesses that you work for, in your organizations, have the ability and the obligation to create supportive and healthy workplace for you and your employees. So NAMI Wisconsin has created a platform for this that we encourage all of you to take a look at. It's an initiative. It's called NAMI Wisconsin Workplace Wellness. And this initiative connects employers and employees of all sizes across the state of Wisconsin, as well as groups like the Rotary, just like all of you watching today. And what we do, it's a landing page. We connect you with presentations, with resources, e-newsletters that you can sign up to receive, and more, providing support and education on mental illness, mental health, and wellness initiatives in the workplace. So some goals of NAMI Wisconsin's workplace wellness initiatives are to educate your leadership staff on how to create a healthier work environment for your employees, for yourself, integrate mental health into your policies, and be able to properly handle the requests of an employee experiencing mental illness or their family member. Provide mental health and mental illness resources for all employees. Those should just be available regardless of the size of your company, your business, your agency, your nonprofit organization, whatever the case may be. This is a big one. Create a culture of change for employee retention, better working conditions, and mental health, mental illness presence for employees and their families and company HR, policies and benefits. And I'll go into a couple examples of these shortly here. Eliminate mental illness stigma and discrimination in the workforce. Connect people with their local NAMI and with NAMI Wisconsin. So give people those resources so they can attend those free support groups and those free educational classes if they need them. And then create an ongoing partnership with us. Have your company become a workplace wellness advocate or a NAMI Wisconsin partner. We're doing something really similar with Michelle at the Rotary, doing ongoing presentations. And this is through our workplace wellness initiative to provide this education and information to the Rotary clubs. But what do some of these presentations look like? Very similar to what I give today. They're really customizable to meet your needs, but just to give you an overview, kind of furthering that mental illness and mental health 101, some general who is NAMI and local resources, integrating workplace wellness into your corporate culture. So really diving into that, balancing life transitions in the office and at home. So you're hitting both personal and professional ends of that. We also do presentations, special populations of mental health. So we could do youth, veterans, autism, and we always just like to preface that we usually collaborate with outside organizations who are the expert on these, and then we kind of come in with a mental health, mental illness NAMI piece. We also do a lot of presentations on active listening. So active listening for you as an employer or as an employee, for someone disclosing mental illness, experiencing a mental illness, or for you just as a person or a family member. This is really important information to know. In terms of workplace wellness, we have a ton of resources that anyone in the state of Wisconsin can offer. On our landing page, we have our NAMI Wisconsin resource guide, which I plugged earlier, our Being Together, so our online support groups and classes. You can find your local NAMI, and then a ton of workplace wellness resources and flyers. So anything from language and which language to use and not, which we covered a little bit earlier. We have a great flyer on coping with life transitions. So tips and tricks if you've just moved, started a new job, had a child or someone that went to college, lost a loved one, whatever the case may be, coping with life transitions. So for this, we're really focusing on the mental health and wellness side of things, but also things that are a little bit more workforce specific, like going from being full-time at home, maybe back into the office and how that affects your mental health, or some tips and tricks for working remotely, or just general on how to create a healthy workplace. So what we're really trying to promote at NAMI Wisconsin through the Workplace Wellness Initiative is let's start the mental health conversation. How do you do that? So we need to educate management and your workforce, talk openly about mental health, promote a healthy work environment. And the big thing is providing trainings on ways to respond to people in a mental health crisis. So creating a healthy work place for yourself. Some suggestions that we have. First, set up a meeting with us at NAMI Wisconsin. Let's kind of discuss your needs and your vision. Is a presentation of workplace wellness a good place to start? But there's a ton of different ideas to kind of get the momentum going internally. So you could start a mental health committee or a mental health focus groups with the leaders and the employers of your company, of your business, of your organization. Review your current best practices, review your resources, and really look to change those and send those out to all of your employees monthly, quarterly. Take a look at your EAP if you have one. This is a big one and a little bit easier to do than people think. Make it known that your PTO sick days can be used for therapists or counseling for other doctors. It's not just a doctor's appointment, right? And this can be used for you yourself or for you as a family member to attend with your loved ones. Incorporate access to care, review your health insurance and ensure that it has comprehensive mental health coverage. Behavioral health coverage is another word commonly seen, and share this with your employees. You may have this in your health insurance through the company that you work for or your spouse, but it may not be written out and you may not be aware of it. So that's really important too. Again, review your EAPs. Be sure your programs include services for mental illness, mental health, substance use disorders, and more for your employees and their families. And get that information to them. Plug that at least quarterly so they know. A big and really easy thing is provide accessible resources to our NAMI Wisconsin resource guide and our website. Then people anywhere in the state can find their local NAMI, have access to free support groups, free educational classes, and free resources just to kind of get the conversation going. Promote work-life balance. That's huge, right? Create a culture of flexibility. And if you yourself are a leader within your company or business or organization, lead by example, which I know can be really tough, but try to keep that in the forefront of your mind. Another big one is talk about it. Share and promote that you're working towards being a more healthy workplace and incorporating more mental wellness best practices into your workplace, and that you're making it a priority for yourself, for your leaders, for your employees, and their families. And again, consider talking with us at NAMI Wisconsin and bringing in presentations like this to help get the conversation going. I go a little bit more in depth just in ways to create a healthy workplace. So you could have quarterly employee appreciation events where you're handing out resources, where you're maybe having a healthy snack, giving people a break, maybe bringing in someone to talk about mental health, or even do something fun like yoga. The options are kind of endless here. Allow your staff and make it known. Take 15-minute mental health breaks, go on a walk, sit in your car, get away from your computer or your classroom or whatever the situation may be, just to kind of take a break for yourself. Some other ideas for those quarterly appreciation events: host mindfulness or meditation events. Show that you're supporting NAMI Wisconsin's workplace wellness. Put that up in your workplace. We have flyers, send that out electronically, put it on your office door. And again, really lead by example. And if you yourself, whether you're a leader in the company, business, or organization that you work for, even just for yourself as a family member or friend, regularly check in with your people. For your employees, ask them, there's a way to ask them about the status of their mental health. So you can say, because again, we're not all psychiatrists or therapists. That's not our role as a leader or as a friend, right? But you can say things like, I've noticed you've seemed a little down this past week. Is everything okay? Is there anything I can do to help you? Just ask. And do not make assumption if someone does disclose to you that they're living with a mental illness or you know this about them. Two people with the same diagnosis can experience very different symptoms and live completely different lives. And some of the biggest things that I want to share and that I want everyone watching this webinar to take away with them from NAMI Wisconsin is that help is available, and it's okay to ask for help for yourself. If one of your family members need help, for an employee you work with, for a friend, there's no shame in that. And the earlier that you seek help, if you're experiencing some symptoms of mental illness, the faster the recovery and the shorter the duration of the mental illness you can experience, and hopefully it won't lead to a crisis. Let's talk about it. We need to support each other. The world is a tricky place right now, and we really need to lean on each other and talk about mental illness and talk about mental health. There's no stigma or shame in asking for that. Utilize and share community and state resources, specifically from NAMI. Incorporate some of these best practices. Look at what's going on at your workplace and see how you can incorporate it. And again, ask and talk about it. Those are the biggest takeaways that I have for all of you here today. I really just want to plug, if you want to look into further getting involved with NAMI, find your local NAMI chapter. If you don't have one, connect with us at the state level. If you want to get more involved with workplace wellness initiatives, look into becoming a NAMI Wisconsin financial partner of ours. We can do a ton of presentations, involve you with a lot of our local events. Become a NAMI member. That's something easy and really inexpensive. We have an open door policy that you can do to stay connected with your local NAMI, your state NAMI, and the national NAMI. Donate to our organization, and just keep visiting our website and stay connected and share what NAMI does. So at this time, this concludes our presentation. So I want to open it up to the floor. We have about 10 minutes left, so we're doing great on time, just to see if there's any questions that anybody has.
Stacy, I'll just say thank you so much. The information was wonderful. Learned a lot more about mental health, mental illness than I knew before, and all of the great resources. And one of the things I really appreciated is the fact that a lot of us need to really walk the walk, right? Like if we're going to tell people to have work-life balance or encourage mental health days or any of that, that we really need to make sure that we're providing them the information, putting up those signs in our doors, on our offices, just that so people know that that is most definitely a priority.
Absolutely. Thank you so much, Michelle. And I know for everyone, a ton of information there. Please take the time to review. And as I said, I will share this PowerPoint presentation with Michelle afterwards. Go through these links, share these resources. And I really appreciate everybody's time today. And Michelle, thank you so much for coordinating this with us. I'm really happy we could make this work for Mental Illness Awareness Week. Thank you so much for your time today. It is so appreciated.
Dodie, do you have a question for us?
I don't, but I may need to get your information because I am the I'm losing my thought like Michelle was this earlier. I am the region person for the Northeast and South regions of for all the coalitions of the Alliance. So I may need to reach out to you to have you do a little presentation, and we have our training Thursday. So this was really wonderful. And I would love to get it more across the state. So, and I'm so thankful for Michelle doing all this continued work in Wanakee. So, but it was really done well and very, I didn't even think about it because my son's on the spectrum, to think that that's part of a mental health and things that, you know, I have to be conscious of him. So, you know, even though we live in this world, it's nice to be reminded that, you know, it was well done. I appreciate it.
Thank you, Jody. I really appreciate that. And yes, I would love to connect. Please feel free to reach out, and thank you for sharing that about your son as well. And thanks for being here today. We appreciate it.
Well, I'll be bugging Michelle for your information, but now I'll have it on the slides, so no worries there. But thank you for taking the time and for what you're doing down in a couple, I think is it this week or a couple weeks from now in person in Wanakee. So
yeah, absolutely.
All right. Well, it doesn't look like there's any more questions, Stacy. I know that though this will be watched by several others, probably at their own leisure. So I just want to thank Stacy, you and your team again for all you're doing at the state, national, local level. We are so appreciative for this partnership, not only for, gosh, our community, for Wanakee, for Rotarians around the state. Lots of great resources that will continue to come out, that so we can continue to create hope in our world for all those we serve. So like I said earlier, for those that maybe caught this at the beginning, but this will be online at both the Rotary level and at the Community Cares Coalition, as well as the resources for you to access. And we look forward to, mark your calendar for January 16th is the next virtual one with balancing life transitions in the office and at home. And yeah, I think next week is what we're having Work to Be Well coming into Wanakee to talk more with our students about mental health and all of those things. So thanks again, Stacy. Thanks everyone for joining us, and continue to create hope and do great things in your communities.
Yes, well said. Thank you so much for having me. Bye, everybody.